So we understand that the transition to the young adult service can be a bit nerve-wracking, and part of the reason for this video is to try and let you know a bit about some of the differences between the children's service and the young adult service to reassure you about what to expect when you move to our team. We know that consistency is really important to help people manage their diabetes, and so there'll be new healthcare professionals to get to know when you join the young adult team. But the good news is there is a consistent group of people that will be looking after the young adult clinic up until the age of 25. When you come to the clinic, you'll either be seeing a diabetes specialist nurse or a dietitian or a diabetes doctor. At the end of your appointment, you'll be asked who you might want to see next time, who will be most useful to you at your next appointment. You don't need to see each of us every time you come to clinic, but gradually over time, you'll likely get to know the whole young adult team really well. When you come to clinic, you might want to come on your own, or you might want to bring someone with you. That might be a friend or a relative or a partner, whatever makes you feel more comfortable. The move into the young adult service is really your chance to take more control of your diabetes. I know in the children's service there's often very frequent contact and a lot of coaching. Things are a little bit different in the young adult service, as we'll be gradually encouraging you to take a greater degree of control of your diabetes and to take advantage of all the things you know about your diabetes and your health. When we see you in young adult clinic, we'll be wanting to hear a bit more about what your preferences are when it comes to living with diabetes. After all, you are the biggest expert in what it's like to be you.
Your diabetes nurse is here to help you navigate all aspects of your diabetes management. From your first driving lesson, from your first holiday, first time at university, or your first job, we are here to help. We discuss anything from sexual health and mental health. We try to encourage independence, like doing your own downloads and coming to clinic on your own, although your mum and dad are still welcome to come until you feel able to come alone.
So your diabetes dietitian can offer you an appointment to discuss all aspects around your nutrition and living with your diabetes. We can discuss your current diet, the types of carbohydrate you're eating or drinking, and how to match these with the quick-acting insulin that you take. So you might already be familiar with carbohydrate counting. However, if you're not, we can offer a practical session to help you with this. Please do get in touch and we can offer support around this. When you also come to clinic, we can discuss how to manage hypos, how to manage snacks, and how to manage alcohol when you're living with your diabetes. We can also offer you support on one of our Daphne programs. This can be done either via Teams or face-to-face. Daphne stands for Dose Adjustment for Normal Eating, and it's a brilliant course to learn in more depth about how to manage your diabetes in a relaxed, non-judgmental environment.
Well, being a young adult is a time that can be really hard, and having diabetes on top of this can be an extra added layer. So in the psychology team, we try to help people with their emotional well-being and their mental health. So we can support people with things like adjusting to a diagnosis of diabetes, coping with diabetes burnout, or any other problems that you face in relation to living with diabetes. We like to problem solve, work with you, see what steps we can take to make you feel better and for you to reach goals that are important to you.
The Young Adult Clinic also includes a diabetes consultant like myself. We're in a good position to help discuss different treatment options, perhaps different technology options, and have a bit of a think about how your diabetes relates to your health more broadly. We're really keen to make sure that you have the best possible information to help you make the right decisions for you and your life. And we're really looking forward to welcoming you to the Young Adult Service.